Good morning, everyone. Happy Friday. I want to thank you all for joining us this morning right before a very busy holiday. My name is Teresa Keene, and I am the acting president and CEO of AgSafe. As of late, we've just had a couple of questions regards to the new COVID-19 prevention emergency standard, and wanted to ensure that we provided you with some good, reliable resources. So I went to our source, Patrick Moody with Barsamian Moody, to help us dive in and figure out the elements of this new standard. Just a couple of housekeeping issues before we get started. I want to make sure that you all know we're not going to use our webcams today, so keep those turned off, and also keep your microphones on mute so we don't disrupt the presentation. Also, if you have questions, I'm going to encourage you all to put them in the chat function. We will get to questions as they come in. Pat has asked that we sprinkle those in throughout the presentation. So if you've got a burning question, please feel free to add that to the chat function, and I'll be looking out for those questions. And finally, this webinar will be recorded, and we will post it on the AgSafe website next week. And with that, I'm not going to take up any more of our precious time this morning, so I'm going to hand it on over to Pat to talk about compliance with the Cal OSHA's COVID-19 regulations. Thank you, Pat.
Thanks, Teresa. I appreciate that. Good morning, everybody. I will start by saying, as I was sitting here waiting for the webinar to start, I got an email. I don't know how many of you get the flash updates from Cal OSHA, but I got a flash update from Cal OSHA saying that a group has filed a lawsuit challenging this very regulation we're going to talk about. I was going to talk about that some in the presentation, but there's a group of ag associations that are getting ready to file a lawsuit challenging Cal OSHA's authority to make this regulation. And so the retail association apparently beat us to it, and they've actually filed a lawsuit challenging that regulation. I will caution you, don't put a lot of hope in any sort of speedy resolution to that lawsuit. So I wouldn't say, hey, stop doing what you're going to do and we're just going to log off. None of this is going to be relevant because I think it'll be a long time before we see any sort of resolution from any of either the lawsuit that's already pending as of now or the one that is expected from the ag industry. So we'll see where those go, but we'll keep you up to date once those things do happen. First, a little disclaimer. Obviously, this is not legal advice. None of you, well, at least not that I know of, are my clients. I don't know who all's in here. If you have questions, give me a call or call your favorite labor and employment attorney and get fact-specific answers to your questions. Here's kind of what we're going to talk about a little bit in sort of this order is the exclusion from work and paid leave, the return to work requirements, your COVID-19 IIPP, specific IIPP plan, notifications, distancing, masking, testing, reporting and record keeping. We're going to touch a little bit, if we've got time, on the vaccine issue. And then at the very bottom, if we have time, we'll get to the housing and transportation rules. There's some specific things in regard to that are particularly important to H-2A employers that are housing and transporting people, and to a lesser extent, I suppose, other people. The housing and transportation isn't as common as it used to be, but it's still out there, and there are some specific things that are related to that in this regulation. I want to caution you that this area of the law, as you know, those of you who get my updates or those of you who get AgSafe's updates can see this stuff changes very rapidly. So while what I'm going to talk about today, obviously I already gave you something that happened this morning. So stuff is happening rapidly and changing rapidly. So don't expect that what I tell you today may necessarily be accurate in 2 or 3 weeks. Because this stuff is changing constantly. The other thing to keep in mind is that not only does the federal government put out regulations, but we've got the state government here. We've got Cal OSHA doing it. We've got counties are doing it. Even cities are doing it. So we want to make sure that when you are looking at some of this stuff, check your local, city ordinances and county ordinances. There's no way I can go through and cover all of those things in this, so I'm going to limit myself to the state regulation. But keep in mind that there are county regulations that might differ from this, and there are even some cities that have regulations that might differ from both the county and the states. They definitely are not trying to make this easy on us at all. But make sure you're checking those things as well. So first thing, let's talk about the exclusion and paid leave. This paid leave is one of the big issues that the lawsuits that challenging this regulation are challenging on, that the Cal OSHA doesn't have the authority to require mandated paid leave. And so that's one of the areas that they're challenging this regulation on. But as of right now, the way the regulation works is that anybody who has tested positive, anybody who has been exposed, and we're going to talk some about what exposure means in a second, or anybody who has been ordered to isolate by a public health authority must be excluded from your work site until they have satisfied the return to work criteria. And we'll talk later again about what the return to work criteria are. They differ depending on whether they've got symptoms, don't have symptoms, that kind of stuff. And then here's the biggie is that they must be paid while they are off work. This means no loss of pay, no loss of seniority, no loss of benefits or other employee rights. Now, unlike the state COVID leave law and the federal COVID leave law, the 80 hours in 2 weeks kind of thing, where you can't require someone to use paid time off or whatever it might be that they have prior to utilizing that 80 hours. Under this regulation, before someone is entitled to this, you can require them to use other paid time off. So if they've got part of their 80 hours still, and keep in mind that the 80-hour thing is supposed to expire at the end of this month. Both the state and the federal COVID sick leave laws are supposed to expire at the end of this month. I don't know if they're going to get renewed or not. I suspect that they will, but as of right now, they haven't. And because this is kind of a screwy election year, on the federal level in particular, I'm not sure what kind of legislation might get done to extend that. The way the California leave law is written, it's tied into the federal law. So it says it will expire as of December 31st this year, or whenever the federal law expires. So I don't know if the state will step in and continue theirs. I don't know what the Fed's going to do, but as of right now, the people still have that 80 hours up until the end of this year if they haven't used it already. So they can use that 80 hours, and then if they run out of that, you can require them to use, if they've got paid time off or your California paid sick leave, your 3 days, you can require them to use that. And once they've used all their paid time off, then you can coordinate what their pay would be with something like, SDI. If they get off and they get disability insurance, you can coordinate so that they're not getting more than 100% of their pay. Same thing if it's a workers' comp claim and they're getting temporary disability payments. You can coordinate with that so that they're not getting more than 100% of their pay. So that's an important issue that is different between this and the other, the state and federal leave laws, where if they've got their 80 hours, they get to use that first before you make them use anything else. Here, you can make them use other paid time off before they get a paid leave on this. I'm sorry, my phone's ringing. And so you want to make sure that if you do that, then you can coordinate if they have some other paid leave so that they're not getting more than 100% of their leave or pay while they're out on leave. So this is a little more detail on that. There's one exception in here that's kind of important to note. If you can establish that the employee's exposure was not work-related, one of the things the Cal OSHA FAQs says is that if you can show that the exposure was not work-related, then you don't have to continue their pay. Now that's going to be very difficult to do, but I had a client call me yesterday with this, and they had the employee tell us, hey, I got this at home because my somebody in my house has it, and I got it from that person at home. So we can say, okay, you didn't get exposed at work. Therefore, there's no obligation to continue the pay. That's going to be difficult to do, particularly when you have some of these presumptions that it's work-related that we've got to deal with. But if you have a way of showing that they did not get exposed at work, then you can, the continuation of pay does not come into play. Again, I just some brief, I kind of talked about this already, this overlaps with the California paid sick leave and the state and federal laws for the 80 hours. And so once you've excluded all or exhausted all that other stuff, you can, they're entitled to pay here unless you can show that exemption of exposure not being work related. Another thing here that's important is it's not limited to one occurrence. So if they, test positive more than once, and that's possible, people are testing positive more than once. If they get exposed more than once, if they're told to stay home by the county health department more than once, then they are entitled to paid leave each time. Again, unless you can show that they didn't get exposed at work. Or if they're unable to work for some other reason other than the prevention of transmission of COVID, if they've got some other condition that's making them unable to work, they have to sort of be able to work to get this paid leave. If they're unable to work for some other reason, then they're not covered. These exemptions here, this is all brand new stuff. It just went into effect 2 weeks ago or 3 weeks ago, less than 3 weeks. There's no real guidance on the exceptions yet. If you want to try and have somebody out on leave and not pay them, I would strongly encourage you to contact your favorite labor and employment attorney and get some advice on how to go about doing that, because it is going to be very fact specific, and we want to make sure we're not unless somebody wants to be the test case, then just go ahead and don't pay them and then call me when you get sued, and we'll take it all the way to the Supreme Court and find out who's right, who's wrong. But there's no real guidance on it, so let's be careful on how we do that. All righty. Let's go here to the return to work issues. I get a lot of questions on this, and this is one of those screwy areas where they keep changing what the return to work requirements are. The more they learn about COVID and how it moves amongst the population and how it's transmitted and what they can do about it, they keep changing what the return to work requirements are. So this is one of those areas where you're really going to want to check and see, up-to-date information when you've got a return to work question. This is also one of those areas where the local counties like to try and tinker with return to work that is different than what the state has done or what the CDC has done. Now, I will caution you that the CDC's return to work issues that we sort of dealt with ever since COVID first came into play, and how long people should be out and how long should they quarantine and whatnot. Those were in fact recommendations. The CDC's return to work issues were recommendations, not actual mandates. These from Cal OSHA are just like any other safety reg, and they are in fact mandates. So you are supposed to follow these. These are not recommendations. These are mandates you're supposed to follow. So let's talk about this a little bit. Again, I mentioned that it changes depending upon whether somebody has symptoms or somebody does not have symptoms. So if they have symptoms, so if somebody went out and they've had symptoms of COVID, and that's another thing where they keep changing what the symptoms are, but sort of the basic ones are the fever, the cough, those kinds of things, the respiratory illness. So when they've got symptoms, they must have gone at least 24 hours without a fever of 100.4 or more, without the use of fever reducing medication. So if they're taking, some sort of even over-the-counter medication to reduce their fever, that doesn't count. It has to be without fever reducing medications. The symptoms must have improved, and that's not an or, that's an and. So it's all three of these things, and at least 10 days have passed since their symptoms first appeared. So if they have symptoms, you must meet all three of those things before they can return to work. Now, obviously, the issue we're going to have in a lot of these situations is you're going to have to be taking people's word for it. Have their symptoms improved? How long? When did they first get symptoms? That's you're going to have to take people's word for it. They can't go to the doctor and say, okay, you first got symptoms XYZ, because the doctor's going to have to rely upon the employee. So we're going to have to sort of work with our employees and make sure that everybody's on the same page with that. For those cases without symptoms, they must have had at least 10 days since they got a specimen collected for a positive COVID test. So this is somebody who has tested positive, but they have no symptoms. You have to have waited at least 10 days since they took the blood sample, or they went and got the Q-tip, stuffed up their nose. And I've had that done. They stick that Q-tip way up your nose. And so it must have been at least 10 days since the test was taken before they can return to work. Now, if they have a public health authority telling them they have to quarantine or isolate, whatever, you have to wait until the public health authority has lifted that isolation or quarantine. And for those of you who haven't seen one of those, you'll get something from your local county health department that says, Jane Smith has tested positive for COVID and needs to self-isolate until, and they put a date in it. Everyone that I've seen has had a date in it. I suppose it's possible to get one without it, but everyone I've seen has had a date in it. And so they can't return to work prior to the county health department telling them that they can return to work. So that's important to know what those dates are. And you're just going to have to sort of, with both of these, take people's word, I guess, on when they got their test taken and when their symptoms started, and have their symptoms improved. That's such a subjective thing. There's really not a way for somebody to for us to test has somebody's symptoms improved or not. So we're going to just have to work with people and do the best we can on this.
Pat, I've got a couple of questions that have come in.
So
is that okay to go ahead?
Yeah.
Okay. So back to the benefits. So the question is, so if all available benefits are exhausted, then regular pay applies to what end?
That is an excellent question, because according to Cal OSHA, there is no end. Once it continues until they're able to return to work. So until they can meet one of these return to work criteria, then they are out and you must continue pay. I've got one, I was dealing with one yesterday where a lady came in May and had a doctor's note that said she's high risk and she should not work. And so they put her out on leave in May and she's still not back. And so the question became, is she entitled to pay under this? And if so, for how long? Now, I don't think she's entitled to pay under this, because I think she's not out because she was exposed at work. But the regulation here does not have a time limit, and it does not have a limit on the number of times that somebody could go out and collect pay under this regulation. It's kind of crazy, but there's no time limit and no maximum number of times they can go out.
Perfect. Thank you. I've got another question. Do all these regulations apply for exempt employees as well?
Yes, it applies for everybody except for a very few exceptions, which I doubt we have in our audience today. But it basically applies to all employees. Yes.
Okay, perfect. Then one last question thus far. If COVID-19 test comes back negative, how soon can the employee be allowed to work?
So it's interesting, because all of the criteria set forth in the regulations assume a positive test or that they've been exposed. And so you would still, if they've been exposed and they go and get tested and they're negative, you would think that they could return to work once they've tested negative, but the regulation doesn't expressly say that. What it says is you're supposed to meet one of these return to work criteria, which would essentially be 10 days after they were exposed, but it doesn't necessarily say that either. So it doesn't really address it. I would think that if somebody tests negative, and you've got sufficient time where, if they go, say they're exposed to somebody who comes into work and they get exposed on Monday and they go get tested Monday afternoon and it's negative, well, they wouldn't necessarily test positive yet. So I think if you've waited long enough, several days for them to have gotten sick from being exposed, and I think it's several days is kind of the accepted scenario there, and they've tested negative, I would think that they can return to work. But it's one of those things that isn't really addressed in the regs. It's not really addressed in the FAQs. It's one of those areas where they kind of left us blind. And the reason I think that's the case is because I think they assume if someone has tested negative, they don't have it and they can return to work. But I'm assuming that, but again, it doesn't say that anywhere.
Okay.
So that's a tricky one.
Yeah, absolutely. We've had, this is caused an eruption of questions now.
Sure.
So we have one county that's no longer providing isolation quarantine orders. They indicate just to adhere to the 14-day isolation.
Mm-hmm.
Is this okay, or is it order a must?
I'm not sure I 100% understand that question.
Okay.
Whoever asked that, if they want to clarify, I don't really understand your question.
Okay, Myra, if you don't mind putting something in the chat, that'd be great. And then one last question will get you keep moving on.
Yeah.
Another one about most of our employees are seasonal. If they are off for the season and get COVID, are we still required to pay?
No. So again, all of these things, even the federal and the state paid COVID leave, and this as well, are their wage replacement. So the idea behind these is they don't want people who are sick coming to work because they're going to miss pay. That's the basic rationale behind all of these statutes, is they don't want people feeling like I have to go to work because I'm not going to get paid and I'm not going to have any money. And so therefore, even though I'm sick, I'm going to go to work. So if they aren't going to be working anyway, they're not going to get paid. So I had a situation yesterday. I'm dealing with a nursery that's shutting down over the holidays. They shut down for 2 weeks over the holidays. That's what they do every year. They shut down before Christmas, and they're down, through the first week of January. And so they have a couple of people who have tested positive. They actually have an outbreak, which we're going to talk about here in a minute, which is more than 3 or more. And so they're getting people tested, and those people who have already tested positive are going out with pay until today. Today they're shutting down for 2 weeks as part of a normal every year shutdown for 2 weeks. And so as of starting tomorrow, nobody's going to be getting paid because they wouldn't have been getting paid anyway. So this isn't something that says you're going to get a windfall. This is something that says we don't want you to lose pay, or we don't want you to feel like you have to report to work sick because you're going to lose pay. So the basic rationale again is wage replacement, not wage enhancement. So if they're not going to otherwise be working, they're not going to get paid.
Hey, more have come in, but we probably should continue.
Sure. And I don't know that we actually have I didn't see a time thing on this, and so I'm willing to answer questions. I don't have to jump off at exactly 10 o'clock or something like that. So we'll make sure we get people's questions answered.
That's great. Thanks, Pat. I appreciate it.
Okay, so here's the return to work criteria when there's been an exposure. So they've been exposed to COVID. Again, this is the 14 days was what the reg said, 14 days after the last known exposure. Now, just the other day, the Department of Public Health, California Department of Public Health, came out with an updated guidance on this. Now, again, the CDPH issued a guidance, not a reg, that says, if they've got no symptoms, they can discontinue their quarantine after 10 days from the date of last known exposure, even if they don't have testing, but they have to wear a face mask at all times, and they have to maintain a 6-foot distance at all times until that full 14-day time period has elapsed. Now, I think it was yesterday, in fact, Newsom issued an executive order overriding the 14-day requirement in the Cal OSHA reg and replaced it with the CDPH's quarantine thing, whichever is, so it's either if they've been exposed, they can return after 10 days, but they have to wear a mask. They have to maintain 6-foot distance until the full 14 days has passed. So by executive order, Newsom has overridden the regulation on the 14-day exposure rule. So that this is one of these things where this stuff is changing all the time. So you've got the state issuing a guidance, you've got Cal OSHA issuing a regulation, you got the governor issuing an executive order. So this stuff is all over the place. So I wish I could give you hard and fast rules that it's going to say, hey, this is going to take you through 2021 and here are the rules, but that's unfortunately not the case. We're going to have to keep looking and seeing what's the most up-to-date information here. A big point back here at the bottom of this slide is you cannot require a negative test for an employee to return to work. If they've met these return to work criteria that are out, laid out here, then they can return to work. You can't say you have to go get a negative test before you return to work. So it's an important issue. I get that question lots, where I have employers wanting to make sure that someone is negative before they return to work, and the reg specifically says we cannot require that. So that's an important point to keep in mind there. The prevention plan. So obviously, I'm assuming most of you know that you must have a COVID-specific prevention plan. It can either be part of your regular IIPP, it can be a supplement to it, it can be a separate policy, whatever you want to do. I will tell you that at the bottom there in that blue link is where Cal OSHA has put out a model COVID prevention plan. I would, as a best practice, I would take their model and use it. To the extent that you try and deviate from their model, it allows some hyper vigilant Cal OSHA inspector to come in and say, you're not doing what you're supposed to do. I know that we all have, very intelligent and experienced safety people and HR people who can come up with a COVID specific plan by looking at what's supposed to be in it. But I would say, as a best practice, take their model and use their model so that they can't come back and say, well, you're not doing what you're supposed to do. I know that there are insurance companies that have put out models. I've had clients that have taken, models from various, their comp carrier or whoever it might be, and use those. And you're probably going to be fine with that. If you don't have one of those, I would download this one from Cal OSHA and use theirs as close as you can keep it to theirs, so that there's no question if they come in and say, and there's a lot of enforcement action going on this stuff. And I've got clients that are getting called in from Cal OSHA about, you're not following your plan, you don't have a plan, and you want to make sure that you can thwart that to the best of your ability. And the best way to do that is to use their model. They can't challenge their model that they put out. So just a little best practice tip there. But the things that's got to be in there is just, it's basically like any other your basic IIPP, but you've got to talk about training. You've got to talk about identifying and evaluating hazards for COVID. You've got to allow the employees to participate to the extent that they want to participate in identifying hazards and suggesting solutions. You want to make sure you're following the regulations on return to work and excluding people from work. You just want to make sure you're following all that stuff. So I'm not going to go through all that, but it's pretty similar to your basic IIPP. But you've got the information here. Again, use the model that Cal OSHA put out. You know, one of the problems we, in particular in ag, see is particularly in, you know, packing houses and things like that, where you're trying to get, you know, 500 or 600 or 700 people in to start a shift, and how do you do that when you can't stagger start times and break times and whatnot. You know, what you're going to have to do is show that you've evaluated your specific scenario, and you've thought about ways that you can try and reduce potential transmission of COVID amongst your employees. You know, you may not come up with a perfect solution, but the important thing, I think, is going to say that you've evaluated it, you've looked at your situation, you tried to come up with ideas, and you know, tried to implement the best you can. That's, I think, going to get you pretty far in saying, hey, I've really tried to do this. Keep in mind that, you know, Cal OSHA has their consultation service, and I'm always an advocate of calling out the consultation service and saying, hey, I need you to come out and help me do this. They will not cite you for any problems they find through the consultation service. Now, the downside is anything that they find wrong, you have to fix. And if you don't fix it, then you can get cited. But as long as, you know, you've called them out, they will tell you what to fix and how to fix it. Or not always how to fix it, but at least give you suggestions on how to fix it. So that's something to consider, is using that consultation service. I've had lots of clients over the years use that to pretty good use. So it's something to think about there. You know, just some more here. We're going to talk a little bit more about this. Some of these things that come up here. You know, you got to make sure that you're training your employees. This is an important thing, that it's just like, you know, heat stress and whatnot. You know, if Cal OSHA shows up and starts talking to your employees about COVID, you want them to know that, hey, I'm supposed to wash my hands. I'm supposed to wear my mask. I'm supposed to, you know, keep my distance from people. They need to be able to parrot that stuff back. So we want to make sure that you've trained that into your employees, and that they know how to parrot that stuff back on what they're supposed to do, and you know, particularly the hand washing and the face covering, and make sure you're requiring people to wear their face mask. You know, I got employers ask me all the time, you know, what do I do when I've got people who won't wear their face mask? Write them up. It's a safety violation. You know, what do you do if they don't wear their eye protection? What do you do if they don't wear their hearing protection? You write them up. You know, if they don't wear fall protection, you write them up. And same thing here. You know, enforce it with discipline, so that if they come in and say, hey, look, your people aren't wearing masks, you can say, you know, hey, when I catch them, you know, so maybe the inspector saw somebody without their mask on, or it's down on their chin or something like that. You can say, hey, when we catch people, we write them up, and you can show them examples where you've written somebody up. So it's important to really follow through on that stuff, because they really are out there looking for it, and they're looking to cite people. All right. So just more on what that plan is. I'm not going to cover all that. Let's skip on to a more interesting topic: employee notifications. You have one business day to notify people that there has been an exposure. So if somebody is in the workplace and they come and tell you, hey, I've tested positive, you've got one day to tell the people who have been exposed that they've been exposed. I would use the same notice you utilize for AB 685. If you guys are not on my email list, you know, I put out samples for that. I think AgSafe put out samples of that, of notices to use. So, but you want to make sure you're notifying people that were exposed. You've got to notify any independent contractors that have their employees in the work site, whether it's FLCs or whoever else it might be. If their employees are there, you've got to notify them that their employees were exposed. If there's a union, you have to notify the union that there was an exposure. And here's at the bottom is when the exposure period is. If somebody has symptoms, it's 2 days prior to the onset of symptoms, and then 10 days after the symptoms first appeared, and 24 hours have passed with no fever or without the use of fever-reducing medication. So that's your exposure period. Without symptoms, it's 2 days after the specimen was collected that resulted in a positive test until 10 days after the specimen was collected. So anybody that's in the workforce during that time period, laid out there as the exposure period, then you need to notify the folks up top of the page that there was an exposure. And you have to do that within 1 business day. Cal OSHA does not require written notification, but AB 685 does. So use that. You can use that notification template that has been circulated. Lots of people have circulated one of those out there. You can do it hand delivery, email, text, whatever you want, but make sure you can show that you've notified the employees and any independent contractor employers, FLC employers, unions if there's a union. Obviously, you can't say, hey, Joe Smith tested positive. It's got to be there was an exposure without identifying the employee. HIPAA still applies. We can't start telling people who was positive, who wasn't. People are going to know. There's nothing you can do about that, but we just want to make sure that we are not notifying people who was positive or who was exposing others to COVID. We want to make sure that stays confidential. All right, distancing and masking issues. The state's shelter-in-place order that Newsom put out is still kind of in effect, and the multi-tier order that he put out is still in effect. And so one of the things is we must maintain 6 feet distancing to the extent it's possible. If it's not possible, you're going to have to explain why it's not possible. So this is one of those areas where when you're going through the IIPP, the COVID specific IIPP, you're going to want to have addressed why you can't keep people 6 feet apart. Maybe it's because they're in a packing line and there's just no way to separate people by 6 feet. But if there's a way that you can do it, you want to show that you've considered it and you've done it. But if you're going to say, hey, there's no way I can separate my people by 6 feet, you're going to want to show that you sat down and thought about ways that you could do so and that those are not feasible. Don't just presume, hey, it's a packing line and there's no way to separate people. You want to show the actual evaluation process that you've thought about it, you've looked at it, and it's not possible. We don't want to go with just the, oh, it's not possible answer. Momentary exposure while people are moving around, for example, in your office, if you got people walking down the hallway, obviously they don't need to be 6 feet apart. If they're just passing each other in the hallway, that kind of stuff, wherever it might be, that doesn't violate the 6 feet rule. Basically, when you're looking at 6 feet distance, you're looking at people being within 6 feet of one another for 15 or more minutes within a 24-hour period. And it's a cumulative 15 minutes. It's not a single 15-minute conversation where you're 3 feet apart. It's a cumulative 15 minutes in a 24-hour period. That's kind of what they're looking at. There's all sorts of different ways you can talk about distancing to keep people 6 feet apart. To people that can work remotely, you got to consider that. To the extent you can reduce people, do that. Signs, the whole one-way walkways that so you don't have people passing each other in the walkway. If you can stagger arrival times and departure times and lunch breaks and rest breaks, stagger those to get less people in your break room, for example, at a given time. You want to show that you've thought about those kinds of things, and to the extent that it's possible, you've implemented things. And I would really encourage you to not be the one that says, hey, there's no way to do any of this. I looked at it and there's no way to do any of this. There's going to be some way you can do something and show that you've adopted some sort of some policy that shows you're doing this. When it's not possible to maintain 6 feet distance. You want to keep people as far apart as possible. Where it's possible, they want you to install the plexiglass partitions in between people to the extent you can. Again, that's something you're going to want to show that you've at least thought of, and if you can do it, you can do it. Do it. If you can't, explain why. Be prepared to explain. And I would document why you can't do it. You want to make sure that this is one of those areas where a lot of it is going to be showing the process. So many times we talk about, what's important, the result of the process. And I think here, really, a big part of it is going to be the process. Have you thought about these things, and can you show you evaluated different options? And yes, you could do it, or no, you couldn't do it. But you've at least thought about it and looked at it and tried to implement different options to keep people apart. Masking, have to wear a mask. It's as simple as that. If they're outdoors and they're less than 6 feet away, you've got to wear a mask, even outdoors. An important note here, and I had somebody who really had a showdown with an employee over this one. Face shields, those plastic shields that people wear, those are not a replacement for a mask, face covering, type of cloth thing over your face, over your mouth and nose. So there are exceptions if you're alone in your office or something like that while you're eating or drinking, obviously. You got to be 6 feet apart. Even then, in the break room, you want people sitting 6 feet apart. If you can supply outside air, open windows, unless it's freezing cold, that kind of thing. If an employee has to wear, respiratory protection, if they're wearing PPE, respiratory stuff, they don't have to wear masks because that's going to interfere with another safety hazard. I've got people who are claiming, medical issues, medical conditions, disabilities, or something like that, where they're saying, I can't wear it. It's going to be just like anything else where somebody claims a disability prevents them from doing something. You're going to have to go through an interactive process with them and explain why they can't wear the mask. And, the employees who say, I'm not afraid of this, the government can't tell me what to do, XYZ. Well, unfortunately, in this area, they can. So they have to wear the mask unless they come up with a viable medical condition, / disability or whatever it might be. Then they got to wear the mask. And so that's sometimes you're going to have a showdown with people. And I've got the clients with employees who are adamant that I'm not doing this just because the government says this. Unfortunately, you're going to get cited if you don't make them wear the mask. So make them wear a mask. And if they won't, somebody refuses a mask, that's a safety violation. You treat them the same as if they refuse to wear eye protection or a bump cap or hearing protection or PPE, respirators or whatever else it might be. It's a safety violation, and we've got to treat it just like any other safety violation. This is a safety reg put out by Cal OSHA that we have to adhere to, and we're going to treat people just like any other violation of a safety ordinance. All right.
We've got a couple of questions that come in regards to that. One was, I was told by an attorney during the summer this past July, which is forever ago now, right?
Right, yeah.
That we cannot write up and discipline employees who do not wear their masks or face shields that we have provided. Is there a retaliation risk from employees if we discipline them or write them up?
Absolutely not. Back in July, this regulation didn't exist, for one. I don't think you would have run into a problem with that before, but no matter what, back then, there was not a Cal OSHA promulgated safety ordinance or regulation requiring mask wearing. There is now a Cal OSHA regulation saying you must wear a mask. And it's just like anything else. Again, I liken it to hearing protection or eye protection or whatever else it might be. If you've got pesticide applicators and they say, hey, I refuse to wear my PPE. Well, okay, you don't get to do the job then, and we're going to write you up, or we're going to let you go. If you refuse to wear safety device, You know, if you got somebody who's climbing up on the outside of a tower to clean something and they refuse to wear fall protection, it's no different. It's that you can discipline people for failing to adhere to mandatory safety regulations. So it's no different than that.
And up to termination. I have a
Yes.
question about that. Okay.
Yep.
Fantastic. All right. Thank
Okay.
you.
All right. Yeah.
Oh, well, one more.
Yeah.
Can the employer ask for proof of their disability if they were refusing to wear a mask because of a medical reason?
Yes, I would go through just like you would with any other interactive process to accommodate a disability. You can ask for that information, which is necessary for you to determine that they have a disability that needs accommodating, and that not wearing the mask is something that you need to accommodate. So can you ask for, a specific diagnosis? No, but can you get information from the doctor that says that this person can't wear a mask because of some underlying condition? Yes, you can. Absolutely. Yep.
Great.
Yep.
And one last question that came in, and I don't know if you'll know this, Pat. Is a face shield with a drape for employee with breathing issues acceptable?
Yes, if they've got something that shows that, and it's kind of funny because that's the first line on this slide. So if you're exempt from wearing a mask, okay, because you got some kind of condition, what you have to do is wear the shield with the drape. But now, a shield with a drape in and of itself is not a replacement for a mask. Someone can't just say, hey, I would prefer to wear a shield and a drape. They can only do that if they are otherwise exempt from the mask or face covering because of some medical, condition. So you can't just say, hey, I don't want to wear the mask, so I'll wear a shield and a drape. It's got to be some underlying issue that prevents you from wearing the mask, whether it's a breathing issue, or one of the examples they use up above here is if someone's hearing impaired and they need to be able to read lips or something like that. So if you're working with a hearing impaired employee and they read lips, so they need to communicate with, if I've got a coworker who's hearing impaired and they need to be able to read lips, I could have to wear a shield and with a drape so that the other person can see my face while I'm talking, right? So something like that, but it can't just be, hey, I would rather wear the shield with a drape. There has to be some underlying reason. All right.
Great, thank you.
Okay, so if the employee has some sort of condition that prohibits them from wearing anything, they must be kept 6 feet apart from anybody else at all times. No excuse. They have to be 6 feet apart, and they have to get tested twice a week for COVID. So if somebody says, I can't wear the mask, I can't wear a shield, I can't do X, Y, Z because I've got a disability of some sort, and it's a legit issue, and there's really no way they can wear that. In that situation, they can go without one. But again, they have to be 6 feet apart from everybody else at all times, and they've got to get tested twice a week for COVID. So testing is not an alternative to wearing a mask other than that scenario. So you can't have somebody who says, hey, I don't want to wear the mask, I'll take the test all the time. And you can test me twice a week, I don't care, I just don't want to wear the mask. No, it's only if they've got some underlying condition that prevents them from wearing. Then they can then they can do the testing, but they have to have that underlying condition. All right. Very good. Testing, another tricky area. So when you've got a COVID scenario at work, you have to offer testing to everybody who is potentially exposed. So that has to be immediately available, it has to be free, and it has to be during working hours. Now, all health plans are required to provide COVID testing free without a copay. Now, I've had employers come back and say, hey, my employees are telling me that they're having to pay a copay. They're not supposed to have to. But at any rate, if they do, the employer has to pay the copay. And you also have to make the testing available during work hours. So it's paid time while they go get tested. So I've had employers say, well, what am I going to do? I've got to send, 50 people out to the county clinic. Well, one option is to bring a testing site to the workplace. Arrange with a testing facility to come and test your people there, and they can stay on the clock and they can get tested. But you have to at least offer it. You don't have to require testing, but it has to be offered to people. Okay, so you must tell them that they can get it. You must tell them it's free. You must tell them that there's been an exposure. You must tell them if you test positive, you have to stay home. So there's all the stuff laid out here. So that's the general testing requirement. That's if you've got just somebody comes in and says, hey, I tested positive and I was at work yesterday. Everybody who was potentially exposed needs to get tested. Now, I'm getting lots of questions about how broad does that get in terms of who all is quote unquote potentially exposed. And I had somebody call me yesterday and said, hey, I got, they're a commercial nursery and they've got 1,000 acres of bare root trees that they grow. And then they've got a facility that's 38 acres, and they've got one place that has a barn on it, and one place that, they do some potting in a separate area. And they're like, if I get somebody that tested positive in the potting area, do I have to test the people that work out on that 1,000-acre ranch? And the answer is no. If you look at the FAQs, and somewhere in here, there's a link to the Cal OSHA FAQs on this. They talk about, that it doesn't mean the entire work area. It means where those people would potentially be exposed. So if you've got people that are going back and forth, and they're intermingling, then it's going to be where those people are. If it's a standalone building, it's going to be in that building. You got to look at what's reasonable where somebody could have been exposed. You don't have to test people who weren't, exposed at all. So if you look at the FAQs, there's actually some pretty decent FAQs on this that Cal OSHA put out, surprisingly. But you want to take a look at that and see. And again, we just remember that the testing is not an alternative to the masking requirements. You can't just say, hey, we're going to test people and you don't have to worry about wearing a mask. The mask is required. So if you have multiple infections, 3 or more people test positive within a rolling 14-day period. So 3 or more within a rolling 14-day period, you're required to provide testing to all employees at the workplace. This is an interesting issue here because throughout the entire regulation, they use the word provide that I highlighted in red there. They keep talking about providing testing, providing testing, providing testing. Even though they use the same word, I think, and the people I've talked to, other attorneys, heads of associations that are talking to their members about it, I think when they say provide for multiple infections, they mean require testing. Because here, if you have 3 or more, you're supposed to test everybody that were exposed, and then test them all again 1 week later. And you're supposed to continue testing once a week, unless the health department says more, until there's no new cases for 14 days. Now this is going to run into lots and lots of testing, right? So if you've got a packing shed that's got 700 people in it, and you got to test them all every week until you go 14 days with no new cases, you're going to have people getting tested all the time. And you're going to want to have some facility that can come test, on site, I think, because again, remember, these tests must be free to the employee and they must be on work time. So they have to be getting paid while they're getting these. And so I think your best option is to try and get somebody to come do the testing on site. But this is a lot of testing. And then when we get a major outbreak here, 20 or more within a 30-day period, you've got to test everybody. You've got to test everybody twice a week after that. then twice a week until there's no new cases in 14 days. So twice a week, you're going to have to test people. And unless the county comes in and says test even more, but twice a week until there's no new cases in 14 days. That is a lot of testing. And I know I haven't looked at what the chat box says, but I guarantee you there's somebody in there that says, what happens if people refuse to take the test? And I think that's just like any other safety violation, that you would discipline them for refusing to take the test. And I would say that if they refuse to take the test, then they are not qualified to work and you suspend them. If you wanted to terminate them, I think you probably could, because this is a mandatory requirement that Cal OSHA is making us do. And I don't think we have any choice but to do so. All right.
Pat, we've got, yeah, the chat box is blowing up right
Yeah,
now.
I thought so.
Well, and I think you've answered some of these, but I think that we're just trying to make sure that we're getting clarification.
Sure,
So,
yeah.
if you don't mind, let's roll through them. Does one positive case invoke testing, or only if there is an outbreak?
One positive test means you must offer testing to everybody who is potentially exposed. So if we look up here, this one, where you've got a positive test, you must offer testing to everybody who is potentially exposed. Doesn't require testing, you have to offer it. And again, that's where we get into this sort of screwy thing here, where whoever wrote this didn't take the time to use, sufficiently clear language to distinguish between offer and provide. So it's and I've gone back and forth with a lot of people, the difference between general testing, the multiple case, and the outbreak, and what's required, what just must be offered. But it sure seems like in the multiple case, 3 or more in a 14-day period, or 20 or more in a 30-day period, that you are required to test people. And on this one, two or fewer, then you are to offer testing to people.
Okay, great. So in the case of where the test was offered to exposed employees and it comes back negative, are they allowed to return to work?
I believe yes. Again, because you've tested them, they're negative. Now, again, you have to think about, is it a situation where somebody gets exposed on Monday, takes the test on Monday, and wants to return to work on Tuesday? I'm not sure if the science is going to be able to say that, hey, they would have a positive test yet. There's no real answer to that. But I think if somebody has tested negative, you can return them to work.
Okay.
And I think, let me put it this way, let me say that with a caveat. I think if you don't let them return to work after a negative test and they say, hey, I want to come back to work, that you've got to pay them.
That's an important point.
Yes.
So it's applicable by site, not overall company, right?
Correct.
Break. Okay.
Yes. And even that, again, if you look at the way the FAQ is worded, it talks about even smaller examples than a specific site. So it could be, a department in a facility. If you've got sort of a segregated area, that's really kind of what they're looking at. They're looking at who could have potentially been exposed. If you've got people in a building, I've got clients that have a packing facility, right? And you've got the office in the front part of the facility, and then there's a solid wall that goes, and the packing facility is behind that. If you get someone in the office that tests positive, do you have to then test everybody in the packing house that's back there, if there's no interchange of people back and forth? Well, I don't think so. And that's kind of what the FAQ indicates.
Okay. Then I've got, what if, because this could happen. Is it an outbreak only if the employee contracts it at work? So like in a situation where you might have a family that works for a company and they all end up getting COVID, maybe not at work. Is it still considered an outbreak?
It doesn't really address that, but I think you have to assume that it does, because let's put it this way: if you have 4 people at home that get positive, and they caught it, and there's 5 people that live in a house, 4 of them work for you and 1 works for somebody else. And 4 of them, catch it from the 5th person who works somewhere else, but they show up at your work site. You had 4 people in your work site that tested positive and exposed people.
Yep. Okay.
I would not want to be the test case on that one, because I think you'd lose.
That's a very good point.
Yeah.
So I also have this one. Did you say that if an employee is off work awaiting a test result, we have to pay them for that time off?
Yes.
Yes. And then if someone who has been exposed does not want to take advantage, oh yeah, the free testing, you answered that. If they don't want to take advantage of the free test or of the testing, sorry, they keep coming in and it loses my place.
Yeah.
If someone who has been exposed does not want to take advantage of the free testing, can they continue coming to work? From my understanding, we can't ask exposed employees to stay home. Is that correct?
I think under the general scenario here, you must offer testing and they don't have to take it. And this is again where the regulation is not clear at all. Where if we go from here to what happened? I didn't to the multiple infection or the major outbreak. I think in those scenarios, you're required to test somebody. And if they refuse to be tested, then they stay home and quarantine and they're not paid.
Okay. Perfect. Oh, we got some more that have come in, but Pat,
Sure.
Do you want to finish up your presentation or do you want to just keep taking questions?
Let's take a couple more. This is a big area.
Okay, yeah. Outbreaks are reported to both Cal OSHA and your local health department, correct?
Yes.
Okay. Okay, got lots of scenarios because this is
Sure.
how it happens, right?
Yep.
In an office of 5 staff where 2 share an office and 1 is in the main front customer service admin area, not a private office, and the two others in their own private office, do all of these employees need to wear masks when they are not in close proximity of 6 feet? I have required that they need to wear them at all times besides when eating.
So the way it's worded is the people in the separate office, if they're in an enclosed office and they can close their door and they're in there, those 2 people would need to wear it because they're in the same room together. Now, the person at the front desk wouldn't necessarily need to wear it, presuming people aren't coming and going all the time. But if there are people coming and going all the time, then they've got to wear it. The only time the exception is if you're really alone in your office and nobody's coming in and going. If you leave your office to walk to the break room or the bathroom or to go outside or whatever it might be, then you're supposed to wear your mask in the common area. Now, if you've got somebody who's up in at a front reception area where people are coming in and customers are coming in and the FedEx guy is coming in and whatever like that, those people are supposed to be wearing one because they're interacting with people that come and go.
Perfect. Thank you, Pat. And I think that's most of them for right now.
Okay. All right. Let's go reporting, record keeping, access. We talked about this a little bit. So if you've got 3 or more cases, so that's an outbreak, you must notify the county. There's all the information you've got to give them. If the county or the state ask for unredacted information with the names and whatnot, they are entitled to get that. So you need to report that. If you've got a serious illness or a death, obviously you've got to report that to Cal OSHA just like anything else. So you want to make sure that you're reporting this stuff as required. You got to report to the comp care within 3 days of a positive test. You got to tell them somebody tested positive. You got to let them know if somebody's filed a DWC1. Obviously, you got to, if someone's filed a claim, you got to do that. And here's the other information that you've got to provide. The one thing that I keep getting questions about, this last one, the highest number of employees who reported to work at the employee's specific place of employment within the 45-day period preceding the last date the employee worked. That's just, it's not, how many, a list of names or something like that. They're just looking for a number. How many people showed up? My understanding is they really just look, there was 100 people there, there was 40 people there, 20 people there, whatever. They're not saying, give me a list of employees. They're looking for the number there. All right.
Pat, I got another one that just popped up in regards to this. Our county is requiring that all cases be reported. Do we follow our county's requirements or Kalosha's?
I would think you've got to follow the counties as well. That's one of the things where I sort of said at the beginning, there are places where the county or even some cities have more stringent requirements than the state does. So I would liken that to, for example, minimum wage, where you've got some cities in the state that have a higher minimum wage than the state does. And you're required to abide by that. I think it's the same thing here. You're required to, it wouldn't work the other way. So let's say your county says, oh, you never have to report to us. You couldn't then say to the state, well, we don't have to report because our county says we don't have to. If your county says you have to, you're required to adhere to the county regulations, even though they're more stringent than the state regulation.
I have one more that came in too. Do you have to notify the comp company if the cases have been proven to be from outside the workplace?
That's a tricky scenario, because there's this whole presumption of, they got it at work. So the way it works is you're supposed to report it and then rebut that they got it at work. Now, I think if you had a scenario like the example I told you guys earlier of my client who had somebody come and say, hey, I got this at home from my nephew or my daughter or whatever it might be. I know I got it at home from them. They've told you it's not work related. Now, if they don't tell you, I think the way that it was an AB 11 or SB 1189, it says you're supposed to presume it's at work, and then you can rebut it to the extent that you're able to rebut it. And I would think you'd want to err on the side of reporting cases as opposed to not reporting cases. So I think unless you have specific knowledge up front that they didn't get it at work, then you should report it and then try and rebut it. Remember, you've only got 30 days to try and rebut the presumption that they got it at work.
Great, thank you. And that is it for right now.
Okay. Let's see. I think we talked about that. Record keeping, you gotta keep all your records. Obviously, you want to make sure you're tracking COVID cases. When they got it, where they worked. What was the last day they worked. You're going to want to track, those information, those dates, so when can they return to work. And you want to keep those in confidential medical files, just like you would any other, confidential medical information. You want to keep all that stuff separate and make sure that it's not out there anywhere. Employees are able to get access to information if it's redacted, so somebody can come in and say, hey, I need to know how many people have tested positive. They would be able to find out, but they can't get the names, that kind of thing. They're entitled to get a copy of the COVID prevention plan, your COVID specific IPP. Obviously they're entitled to get log 300 records, just like they would for anything else. They're entitled to see that, but they do not get unredacted information. They get redacted information only. All right. Some vaccine issues. This is going to be an interesting one. New York has proposed a mandatory vaccination, and what they're going to say is if we determine that there's not sufficient immunity from COVID, the Department of Health in New York is going to require vaccinations for everybody before they can go back to work. California has not proposed one of those yet. I will know that you guys all know that anything, New York can do, California can do better. So my guess is we'll probably see one of those at some point. And then you're going to get into a whole host of issues of, can you require somebody to take a vaccine prior to going to work? And I guess we would see a lot of litigation over that, and privacy issues and health concerns and whatnot. But we're not there yet. But I just wanted to throw that out there that there's already talk now because of the vaccine getting shipped out. Pfizer's is out, Moderna's has been approved as of I think this morning. And so there's going to be vaccines out there. So the question will become, can we require a vaccine of people? And I don't think that that's going to be something that we're going to be able to require without some sort of state mandate saying they have to get vaccinated. And then the question becomes is, can the state require somebody to get a vaccine? And that will just result in a lot of litigation. I'm not sure where that will go, but that's just something to think about down the road. And the way they've sort of said things now is, we can require COVID testing, and we can require that people before they work get tested and show that they don't have it. And what the EEOC has said on the federal level is that if someone can't show that they're negative, then they're not safe to show up to work because they're a direct threat to the safety of other employees in the situation of a pandemic like this. And so, that California kind of agrees with that scenario. You'd have to look in terms of reasonable accommodation for people who have medical beliefs about vaccines or religious beliefs about vaccines, things like that. You'd have to look into reasonable accommodations for people. But that's none of that is here yet. I just wanted to throw that out there to just give you one more thing to think about. But that's something that may be coming down the road at some point once this vaccine becomes more widely available. Is what are we going to do in terms of requiring vaccines? And so we're gonna see. EEOC is saying that we can require it based on safety-based standards, and I think California is going to agree with that, but we don't know. We're going to talk about this whole interactive process on disabilities or religious beliefs or whatever it might be, and so we're gonna have to see where that goes. But so far there's nothing from the state. Housing and transportation rules. If you've got housing, there's some of these new rules in here that you must implement. Try and keep families in the same housing together. People who are on this who travel together, carpools together. If they're the same crew or same shift, so you want to try and keep people together so that you're risking or reducing the amount of time that they're interacting with other people. So you want to make sure that there are, if you've got housing, that there's sufficient social distancing between beds, for example. You're not allowed to have bunk beds. That's one of the things that is specifically says you can't have. You're not supposed to have bunk beds. And so, this really runs into those people who have H-2A employees, is you're really going to have to look at how is the housing set up to comply with this. This bottom one on here is a real controversial one. So if you got somebody who gets exposed to COVID or somebody is positive for COVID, you have to isolate that employee and provide a private bathroom and sleeping area, cooking, eating area. So does that mean you're going to have to go rent them a hotel room? And then how do you do that when they're COVID positive, for example? Or do you have to take everybody else out of the housing and put them in a hotel? This is a real sticky wicket in terms of that. And the people that drafted this, I don't think thought a whole lot about it, but these are some of the issues you're going to have to face. If you've got housing, make sure, again, I talked about the beds being 6 feet apart and no outdoor or bunk beds, you want to make sure that you're using ventilation systems to the extent you can, and that there's some open window issues you can do depending on what the temperature is outside. And if it's below a certain temperature, you have to have the windows closed with the heat on, and if it's above a certain temperature, you have to have the windows closed with the AC on. And so, but otherwise, you're supposed to be able to have windows open to ensure outside air is mixing in. But there's some of these housing rules that you're going to have to think about in terms of housing. Transportation, again, you want to if you're doing transportation, you want to make sure you're combining people from the same house together, and then the same crew or same shift and same work site. So you want to make sure that you're trying to keep people as separated from other people as possible. If they're carpooling or in a van for the employer, they're supposed to be wearing masks. Make sure that there's masking going on, that people are distanced. There's this issue here. Vehicle operator and all passengers are separated by 3 feet in all directions. That's so it's like you have one person in the front driving and one person front passenger, and then rear passenger, they have to be 3 feet apart. If you got busing or vans, they're supposed to be screened prior to getting on. They have all this extra cleaning, clean the door handles, clean the buckles, armrests, all that kind of stuff before each trip. You got to make sure that this is getting sanitized. This is one of those, like the vehicle operator and all people are separated by 3 feet. Fresno County has issued a new 8-page ag employer supplement to their deal, and it's one of the areas where it's a little confusing what they mean by that 3 feet in all directions kind of thing. Theirs is worded a little differently. So make sure you're looking at that stuff if you're providing transportation, and make sure you're looking at your county and even local city ordinances on what you're having to do with that. And this is where we talked about, the windows have to be open unless it's over 90 degrees and you got the AC on, or it's under 60 degrees and the heat, it says heating, it's supposed to be heating is in use. You got to make sure that you got the special cabin air filter, and you want to make sure that people using hand sanitizer, all this extra cleaning and stuff. So just keep that in mind. If you're doing transportation or you're doing housing, there's going to be special rules that you're going to have to comply with in terms of housing and transportation. And that's it. That's everything I've got. So if anybody has questions, I'm happy to answer some more questions, or we can go shaking our heads into the rest of our Friday.
Well, Pat, I do have a couple more that have come in. How about, are we allowed to do random COVID testing for H-2A employees?
I don't think you can ever do random testing for anything. I think if you want to test everybody, you can test everybody. I think if you've got probable cause to test somebody, a reasonable belief to test somebody, hey, I'm going to Vegas for the weekend for a wedding, kind of thing, and they come back and you test them, I think so. But I don't think random testing is ever allowed.
Okay. How about, can we suggest that our employees get a vaccine?
You could certainly suggest it. I would be careful about doing so, because I think that you could run a situation of somebody saying that if they don't get it, they felt pressured to get it, and that they have some sort of religious belief against getting vaccines, and that if something bad happens to them, they're going to blame it on that. So I'm not sure I would suggest it. I would say you can make information available to them, and I wouldn't suggest yes or no.
Okay, great. Can you please clarify the rolling 14-day period related to 3 or more positive tests?
Yes. So let's say you get somebody who tests positive on the first day of the month. Okay. And nobody tests positive again for, until the 16th. On the 16th, a new 14-day period starts happening again. So somebody tests positive on the 16th and on the 20th. On the 20th, the new 14-day period starts rolling. So you start, you can't, your 14-day period doesn't end until there's been 14 full days without somebody being positive.
Great. Thank you. And then I had one earlier that I lost, and it was in regards to say that you it's a family business and the owners end up contracting COVID.
Mhm.
Is that reportable? And
Yeah.
yes, okay, great. And one more's come in. Okay, do you need to have a shield barrier or plexiglass at a front reception area?
I don't think there's anything that requires that. What I think you would want to be able to show, though, is that's one of those things you've considered. Does it make sense to do so? And if so, do it. If it doesn't make sense, then don't. I think that's one of those things that you have to at least show you've considered.
Yeah, and we're being proactive.
Yep.
Great. One other thing I thought I'd quickly mention, and when we were talking about housing and transportation, there is a program called Housing for the Harvest. So if you end up having somebody that has tested positive, in some of the counties, they have hotel
Right.
rooms that employees could utilize in order to separate from others. So I just want to
Right. I forgot all about that. That's a good point. Yep.
And I think that's it for
Great.
all questions. So thank you so very much for your time
Sure.
and just providing leadership in the industry and giving us some really valuable guidance and resources in order to figure out what this all means.
Very good.
Happy holidays to everybody. And quickly before we leave, I just wanted to mention that there is a stakeholder meeting for Kalosha today around the emergency temporary standard at 12 p.m. So if you want to get involved and have your voice heard around the emergency standard, that is happening today. So just wanted to remind people to get involved if you so be it. So anyway, thanks again, everyone, and happy holidays, Merry Christmas, be safe, and catch you on the flip side.